Channel 8 on Facebook. Search it on your side. Now on News Channel 8.
It's all about control. Who is controlling our lives? Ourselves or the government?
The heated debate over health care reform continues. Tonight, Florida's governor weighs in on the issue with some colorful language against the president's plan. Plus,
live from the News Center in high definition, this is News Channel 8 on your side at 6.
Good evening, everyone. I'm Josh Thomas. Thank you very much for joining us tonight. The debate is raging on this weekend over health care reform. Protesters held rallies in the Bay Area today, while President Obama spent the day trying to set the record straight on what's fact and what's fiction in the proposed plan. News Channel 8's Natalie Shepard begins our team coverage of the health care reform debate live from our Tampa studio. Natalie?
We've heard a lot of angry words exchanged in this health care debate, Josh, but several different groups of protesters took to the street today with a more subdued message. They're outlining their concerns with the health care proposal, and they want answers from lawmakers. No yelling or screaming at this healthcare rally, just the sounds of traffic and conversations about reform.
That's what we're doing here. That's what we're doing here.
Several dozen people gathered outside Congresswoman Kathy Castor's office on Armenia Avenue Saturday afternoon.
People are very nice. We're talking to people of different opinions and listening to what they have to say. I'd say it's very calm.
Many are part of a group called Citizens Protecting the Public.
I don't believe the government can spend my money better than I can. I want them to protect the citizens. I want them to provide infrastructure. I don't want them involved in every aspect of my life.
They held signs with slogans such as, "Obama, the honeymoon is over." These protesters aren't yelling ugly words to get their point across. Instead, medical professionals like Kim Irvin says she supports some kind of reform, just not the proposed bill.
I think we should fix the problems that we have, not overhaul the whole system. There are many things we could fix.
This discussion is morphing through the propaganda from a variety of sources into trying to make the people believe that health insurance reform is health care reform.
Erna Black expressed the fear many opponents feel. She says she's never come out to stand for something like this before, but she worries about the cost of the plan and what that will mean for the future.
I owe nobody nothing. When I got in a hard spot, I cut back. I didn't throw money at things. That's insane.
Governor Charlie Crist called President Obama's healthcare overhaul cockamamie during a speech in Orlando this weekend. He also says what's happening in Washington is nuts. Protesters agreed with those sentiments, saying they don't want the government involved in every aspect of their lives. I'm Natalie Shepard, News Channel 8.
Quite a lot of agreement between people who probably previously might have thought that there was no place to agree. A lot of good discussion. A lot of good discussion. You know, the Baucus Grassley plan that Rahm Emanuel is pushing on us as a public option or not is wholly is something that we don't want to have because it's not good for the American people. It's good for the insurance companies, and make no bones about it, the insurance, as someone who's run for office, I understand how this works, and the insurance companies and the pharmaceutical companies are authoring this bill, campaign contributions, that's with that $1.5 million a week that's being spent on political war chests.
What do you think is your role out here?
My role is as a healthcare professional with political background who understands how things work, having been approached to be bought off in the 2006 election by one of those Washington lobbyists and having turned it down. I can bring a measure of understanding to people who are out here that they don't ordinarily get. And as someone who takes care of patients on a daily basis, has for many years, I understand a lot of the problems that are being discussed, whether it's people's access to health care, rationing, which occurs now, and especially if you don't have health care, that's the ultimate rationing, if you don't have access to health insurance. And the fact that this discussion is morphing through the propaganda from a variety of sources into trying to make the people believe that health insurance reform is health care reform.
And you're a doctor?
I'm a nurse practitioner. ran for Congress 2006-2008 against Gina Brown Wade.